This afternoon we're meeting the candidates for our local areas to discuss our ratios with them. So we're trying to get our 1 nurse to 3 patients mandated in emergency.
If we had a 1:3 ratio, we'd be better equipped to deal with the acuity of those patients and manage those patients effectively.
In our emergency department there is 1 nurse to 4 patients in the acute care section. Sometimes it's 4.5 patients where you share the half patient, and our patients are suffering. You know, they sense that our nurses are stressed.
And I've heard the stories here today about the stress that is looking after so many patients.
At the moment, EDs have the highest turnover rates in terms of nursing. In the last year we've seen several of our qualified nurses leave because they just don't want to do it anymore.
When the nurses are overloaded, when they can't attend to the patients as thoroughly and as properly as they'd like to, it means the patients suffer. And that also creates increased costs for the health system.
Yeah, we've managed to have a good chat about the nurse-to-patient ratios as well, and they understand why this is so important.
One of our main complaints at the moment is communication. So if we can improve our ratios, maybe we can better communicate with our patients and be there for them.
They're real life stories, that they happen every week, and it's a very serious problem that needs to be addressed.
So I've signed a pledge, if elected, to support in the Parliament to have ratios of 1:4 throughout hospitals generally, and for the emergency departments 1:3.
So it'd be great to keep our nurses there, and I've still got so many years ahead of me and I want to be able to do that with a smile on my face.
1:3 in ED.